Addiction, homelessness, mental health struggles. It is a painful and vicious cycle.
And right now, the overdose crisis is hitting parts of Massachusetts harder than ever. The state is spending more money to address the problem, but 5 Investigates' Mike Beaudet discovered more people are now losing their lives to this epidemic.
That tent's no good, but there's other tents over here that we have.
This is Matt's home.
There's a path right there that I go down to go swimming in.
A homeless encampment in Fall River.
Just so I can show you how my bed is all set up. These are my sternos. That's what I use for heat.
Matt says he stopped smoking crack cocaine after suffering a stroke.
I've been about 14 months clean on the drugs, but I won't quit drinking or smoking cigarettes.
He can't afford an apartment, so he's been living out here for almost a year.
It's scary because you hear a lot of stuff. You don't know if people are going to come down here, cut your tent open, or while you're sleeping, somebody can take your tent.
So there's usually about 5 or 6 people out here.
This is the front line of Fall River's overdose crisis.
A lot of them have substance use issues, alcohol, heroin, fentanyl.
Nicole Kennedy is part of the city's FAST team, Fall River's addiction support and treatment response team, visiting homeless encampments like this one multiple times a week.
Interacting, we bring them supplies, sometimes we bring them Narcan. We always want to get them off of the streets and out of the tents and into a program, but not all of them are willing.
While the state hasn't released final numbers for overdose deaths in 2022, some of Massachusetts' biggest cities say they've seen an uptick in fatal overdoses. Deaths are up in Worcester from where they were in 2021. In Lynn, deaths increased from 61 to 63. And here in Fall River, there were 67 fatal overdoses last year, up from 62 in 2021. It's the first time since 2016 that overdose deaths have increased in the city.
Obviously, our deaths ticked up a whisker this time, but we're fighting the good fight.
Fall River's mayor calls it an uphill battle.
When people pass away, it seems like someone else fills the gap for them, and it's really regretful because we do not want people involved with this kind of stuff at all in the city.
It's not for a lack of resources. The Baker administration increased funding to address the overdose crisis over the past 3 years. Money going toward harm reduction, treatment, and recovery programs.
I tore my ACL going into my senior year in a championship softball game. 40 college scouts, and I was prescribed OxyContin.
Nikki Fontaine understands the struggle. She lived it.
And I spiraled down, dropped out of college, and became a heroin addict.
She ended up homeless on the streets of Fall River for 9 months.
I was 30 years old with a needle in my arm, homeless, wheelchair, had absolutely nothing.
Fontaine has been clean for almost a decade. Now she works as Fall River's substance use and homeless outreach director.
Why do you think overdose deaths have gone up?
So I think it's a combination of things, honestly. People think they're using cocaine or benzos, and it's actually pressed with fentanyl. Everything has fentanyl in it. So we're seeing people that have never touched an opiate are now deceased because they thought they were using something else.
What's the solution?
There is no solution to end all overdose and addiction issues. They need mental health, they need education, prevention, get to them young. There is hope. That's the biggest thing. I was able to turn my mess into a message. Never lose hope on yourself.
Fontaine says part of Fall River's strategy is not waiting for people to say they need help. They're going to people, giving them help, and letting them know there's a better way to live.